It is definitive surgery. You're fixing the problem, you're cutting it out. And many of those patients will do well. Success rate on it's better than 90%, and even higher depending on how you want to define success for it. But clearly, my office is filled with a lot of patients who have had total joint replacements and they still have joint pain just as bad as before. So obviously there's a lot of factors that get involved with treating the pain from the arthritis. Part of the reason for developing the IO-Core procedure was to try and give another option for patients, an option that could either delay surgery or perhaps even replace it. If you look at the average life of a total joint, it might be 10 to 20 years. I believe 15 is around the common number on a knee replacement. If you're a young person, let's say you're 50 years old, and you're very active, your first knee replacement will come when you're 65. Even though it's a big procedure when you first put it in, to redo it, to take out the old knee and put the new knee in, that's an even bigger procedure. Not many docs even do that. A lot of times you have to go to a university program or a specialty center that can support redos. And then each time they do it, they got to take out some bone. You got this big rehab, you're down for 6 to 12 months again. And let's say you get through age 65 okay. Now it's 15 years later and you're age 80 and you got to go through another replacement. And those things just don't get easier over time. So a young person with bad arthritis is potentially looking at 2, 3, 4 joint replacements in their remaining lifetime. And each time it's going to be a bigger and bigger deal with all kinds of opportunities for the person to have bad outcomes. Wouldn't it be great if you could offer a solution? If in the worst case, if it just bought them another 5 to 10 years, maybe it would save one of those joint replacements in their lifetime. We are in the process of doing research now to see how effective this technique is. We're looking to see how long the effects last. There's already some previously published studies on related techniques that shows that duration of benefits of greater than 10 years is easily possible. It was demonstrated in one previous study. We're hoping that the benefits may be even more than that. And then when you look at the low risks of this procedure, no one dies with this procedure. There's no prolonged recovery. There's no nursing home time required for this. There's no extended physical therapy. We can do this at a fraction of the cost of what a total joint replacement is. So one of the options is, let's say worst case scenario, we only had 10 years or even 5 years as a benefit. And the patient during that time was able to walk around, do their normal activities. They were able to forego a total joint replacement. What if it were as simple as in 5 or 10 years, you just repeat that procedure. They're down for a couple of days again, recovering from the needle procedure, which is what the IO-Core procedure is. And they're good to go again for another 5 or 10 years. I mean, we need to do the research to find out how long this is going to last, how solid the effects are going to be over time. But there's every indication right now that this will be a long-lasting procedure that will give very effective benefits to the patient over time. And with a little bit of luck, maybe no one would ever need to have a joint replaced again.